Hi friends, welcome to the channel Nursing MCQs. Today we are going to discuss about few questions for the norcet exam. The given question is, what is the process in which oxygen is administered at greater than atmospheric pressure? The given options are non-invasive ventilation, oxygen by nozzle pumps, oxygen by NRBM, hyperbaric oxygen therapy. The correct answer is hyperbaric oxygen therapy. In hyperbaric oxygen therapy, the patient is set in a oxygen chamber. In this chamber, the oxygen is administered to the client at a greater pressure, which is greater than atmospheric pressure. Next question. A client with right arm AV fistula is not recommended for taking blood pressure and venipuncture on the same arm. Why? The given options are risk for clotting, risk for infection, damage to the fistula, all of the above. So, according to the given question, all the options are correct. Taking blood pressure and doing venipuncture on a fistula placed hand is not recommended because it will cause damage to the fistula, and doing venipuncture also prone for the risk of infection and clotting. Next question. What are the characteristics of a circulatory overload? The given options are hypotension, bounding pulse, distended neck veins, and option 2 and 3. The main characteristics of circulatory overload is bounding pulse and distended neck veins. So, the correct answer is option 4. Next question. What are the normal levels of magnesium in the blood? The given options are option 1 1.4 to 1.8 milligram per deciliter, 1.8 to 3 milligram per deciliter, 3 to 4 milligram per deciliter, 3 to 5 3.5 to 5.5 milligram per deciliter. Normal magnesium level in blood is 1.8 to 3 milligram per deciliter. Less than 1.8 leads to hypomagnesemia. Hypomagnesemia causes dysarrhythmias because it affects the myocardial nerve cell impulse conduction. And low magnesium levels will lead to occurrence of seizures. So the correct answer is 1.8 to 3 milligram per deciliter. Next question. What is the most important electrolyte responsible for nerve cell impulse conduction? As we discussed in the previous question about magnesium, magnesium plays an important role in the myocardial nerve cell impulse conduction. So let us see the given options. Option 1 is sodium, option 2 is potassium, option 3 is phosphate, option 4 is magnesium. So the correct answer is magnesium. Magnesium plays an important role in myocardial nerve cell impulse conduction. Low magnesium levels will lead to dysarrhythmias, especially ventricular dysarrhythmias. Low magnesium levels will lead to the occurrence of seizure. So there is a priority for seizure precautions.